How do you want to do
Assalamu alaikum, and you are now tuned to Shakil and Couple on America's Islamic Radio. Today's exciting interview sponsored by JG Advisors, Elements Dental, AT&T Astoria, The Mugs and Beans, Tech Bite, Gyrospot, Freedom Line Brokerage, and Glide Management. Today we have none other than the man, the myth, the legend, dentist Dr. Abdulla Zoobi. Assalamu alaikum, how are you doing today?
Wa alaikum salam. God bless you, Kevin.
Listen, we've been trying to get Dr. Zoobi here for a really, really long time. You know, one of the questions we kept getting asked was, hey, we should have more doctors, we should have more dentists in here. So listen, we got none other than the most famous dentist here from Elements Dental of New York, in Steinway, on Astoria, one of the best dentists that I've ever met in my entire life. I'm not scared to go to him. Dr. Zoobi, how you doing today?
God bless you. Only for you, Kevin. Only for you.
Absolutely.
God bless you. God bless what you're doing for the community. Definitely need a lot of people like you bringing this all together.
I'm so happy to have you
God
out
bless.
here.
God bless
so
you.
happy, so happy. So there's basically a snap of fact that I read today. It said, people who smile more live longer.
Oh, definitely, 100%. It's sunnah. At the end of the day, it's sunnah to smile. Definitely, a lot of oral diseases linked to diseases within the body itself, especially periodontal disease linked to heart disease. So definitely very important to take care of the teeth, brushing twice a day, flossing twice a day. Every community is lacking in flossing. Nobody likes to floss. I don't like to floss. My kids don't like to floss. But it's definitely great to floss because you get your teeth clean, get the gums healthy. It's linked to inflammation. Inflammation increases in the body, and everything snowballs from there. So definitely a good thing.
You're jumping way ahead. Can I ask a question first? So I want you to explain to people the importance of oral health care.
Oh, definitely, 100%. I said it's definitely linked to a lot of the chronic diseases within the body itself, especially heart disease. Heart disease is 100% linked to inflammation, and if you encompass the whole the whole area of the mouth, it's probably equivalent to about here to here on your hand, on your arm. With that surface area, if you had an infection on your arm, you would definitely go see a doctor to relieve that infection. So pretty much, if you're not taking care of your gums, not taking care of your teeth, you pretty much have that size of an infection, pretty much spreading within the body itself. And that's how pretty much it's linked to everything else in the body as a whole.
But Dr. Zoobi, going to the dentist as a young kid, right? I got traumatized.
Oh, yeah, we all did.
The drill,
oh, yeah.
the pain. Oh, yeah. I mean, let's say you have a person who is afraid to go to a dentist. How can that experience be much better and less traumatic?
I definitely get the kids to the pediatric dentist, 100%. Don't bring them to me. I love kids and all, but not in the dental chair. It's cool, though. We still see them. We get a lot of kids, but especially kids that have a lot of cavities. We definitely want them seen by a pediatric dentist. It gives them a really good experience.
So how early should kids start going to the dentist?
I would start bringing them the second you start seeing teeth, just so at least they can go meet the dentist, see that it's a fun place. A lot of dental offices now, they're making it more geared towards giving the kid a good experience. So if you have a kid that's like 2 years old, you know they don't have any cavities, but still bring them in just for that experience, just so you know that it's harmless. They're going to have somebody look at their teeth, maybe take an x-ray or two, or not even that, just so early. But I would definitely start getting them introduced to the whole environment. And definitely pediatric dentists would be a great place because they have the whole office with dinosaurs and cartoons on the walls and the goodie bags that they get to see at the end. So they know from when they're 2 years old that, okay, this is a safe place, so if I ever need anything done, they're not going to hurt me. They're nice people.
So let's get back to the adults.
The adults, yes.
Where you're an expert at,
yes,
yes.
Yes.
So I get this postcard from your office every 6 months.
Yes,
you
yes.
have to come
yes,
back.
Absolutely,
you have
absolutely.
to come back. Why is that so important? Why do I have to come back every 6 months? Why can't I come back after every year?
Well, the thing is, with the mouth, you have a saliva that flows and flushes everything out, buffers your whole system for you. But within that saliva, there's a lot of calcium, and it clings to your teeth. So no matter how hard you brush, you're not going to get those calcium deposits out. And that's what really causes all that inflammation. So imagine like the bottom of a ship that's constantly rolling through water. You got chunks of plaque at the bottom of that ship.
Mm-hmm.
Those chunks of plaque are in your mouth as we speak, being built and getting bigger and bigger. So let's say we haven't seen a patient in a long time. They haven't come to the dentist in a couple of years. We whip out a mirror, show them what these plaque deposits look like. And some people actually think that that's part of their teeth, but it really isn't. So we scrape all that stuff away, clean it out, show them what it looks like afterwards, and you actually start feeling your teeth. And within our community, I've also known that we don't really start so early with the kids.
Hmm.
So you get a lot of people that are in their 50s, 60s, the older generation that hardly saw dentists in a way back home. They only see a dentist when there's a problem. So there's a lot of misinformation, especially within the community from back home. When to see a dentist, when not to see a dentist. Definitely want to get a checkup every 6 months. A lot of the older patients probably every 3 months for a deep cleaning if they need it. But the go-to standard every 6 months, checkup and
Every
cleaning.
6 months. So that's why
Catch everything small. It's a lot easier. It's a lot more affordable catching like a small filling to restore it than probably and turning into a root canal, and then you get a major bill. So that's it's definitely better to catch things early.
So we're talking about a little about prices right now, right?
Yes, yes.
What's the average cost to fill a cavity?
Fill a cavity is probably like $100, $200 for a small cavity. But when you start needing a root canal and you need a crown, you're looking $2,000 and up. So it's not really in your best interest to catch things when it's too late. So definitely check up and cleaning every 6 months. Catch things when they're small.
So if you guys haven't gone to the dentist in the last 6 months, I definitely recommend
100%,
Element Dental
100%.
by Dr. Abdulla
Thank
Zoobi.
you,
You're going to
thank
get treated so nice and so kindly and be well taken care of.
We definitely take care of the community. We get a lot of patients from the community. We've been in Astoria now for about 12 years.
It's a really long time.
Yeah. Definitely fun times there. But we definitely see patients, of all ages. Many patients are 6 years and older. A lot of our patients are patients that, 50s, 60s needing dental implants. We do a lot of implants. But our goal is for the next generation that's coming up now with your kids, definitely get the kids checked out early before things start, before a kid starts to get 5, 6 years old, he's having more cavities, then it's definitely prevention is key. Prevention is key.
So if you guys are now tuning in, you're listening to Shakil and Company on American Islamic Radio. We have none other than the legendary Dr. Abdulla Zoobi from Elements Dental. I want to touch on something that my wife always talks to me about, right? Tooth decay.
Tooth decay, yes.
Can you give me a little bit of information on that from a doctor's perspective?
Well, tooth decay, the mouth can go from an acidic environment where, let's say you drink some soda. For about an hour or so after you drink some soda or you have some candy, the mouth stays very acidic. So within that environment, you have acid attacking the teeth, it starts stripping away at the enamel. So, once in a while, it's not a big deal. But let's say you have like a couple months go by, and that mouth stays in an acidic environment, it's going to be turned into something where you start getting little calcium getting withdrawn from the tooth itself.
Mm-hmm.
So it's a little hole starts to form. If we pick it up on a 6-month exam, I'll tell you, hey, listen, you maybe rinse after every meal, rinse after if you drink any sodas, stick to waters, stay away from sodas, stay away from juice.
But it's so good though. How can you stay away from soda and juice when it's so good?
Oh, we did it. Get used to it. We started off with our family. We don't have any juice in the house. Maybe some apple juice every now and then for the kids. We switched from sodas to seltzers, and now we're pretty much on water. But it starts small. It takes time. But definitely, we weaned off of sodas probably a couple of years ago.
Wow.
We keep it to strictly water. The kids, when they see Coca-Cola or Sprite, they're like, yeah, let's get some Coke, let's get some Sprite. But they know what the answer is going to be. So on special occasions, they can have some soda.
So I'm a person who actually uses braces, right?
Yes.
Obviously, that's not true, especially orthodontics, right?
Yes.
But I went to your office and I seen a sign for Invisalign.
Invisalign's cool.
What's all that about?
Well, Invisalign was made by somebody who had braces. So after you get the braces done when you're like a teenager, they give you a retainer to wear afterwards.
Very, very horrible experience.
Nobody wears the retainer. So
Guilty,
yeah,
guilty,
I didn't wear mine
guilty.
either. So what happens in your adulthood? You start seeing you're not happy with the smile. Teeth are crowded. Teeth start to move. Teeth start to shift. So what ends up happening is you end up seeing me, and then we'll say, listen, I guess I'm getting some food getting stuck in between those crooked teeth. Let's do some braces. Let's do some Invisalign. As an adult, you're not going to wear metal braces. Let's get that together. So a lot of people will rather not have that whole experience of getting the full metal braces. So we always recommend Invisalign.
But how fast can it actually straighten your teeth?
Well, actually, it does just as good of a job as braces do, and probably 95% of the cases. Some cases are extreme; they do need metal braces. They definitely need to see a specialist to do them. But with the Invisalign, it was pretty much an investor, a guy who was in business school, who didn't wear his retainer. What he ended up doing was he found his retainer after a couple of months and squeezed it in. and by squeezing in his retainer, his teeth shifted back to where they were originally.
Mm-hmm.
Long story short, he figured out, hey, why don't I just make plastic retainers every 2 weeks to shift the teeth instead of a metal wire? And that's pretty much how that's done. Invisalign is pretty much a plastic retainer. Every 2 weeks you change it, and every 2 weeks the teeth are shifting little by little until we get what we want. I would say in 85% of the cases, right off the bat, we'll say 6 months to 9 months, we can get those teeth straight. Some instances where the cases are a little bit tough, we get towards the end of the treatment. We're not quite there yet. We take another set of impressions, send them back into Invisalign, and pretty much add a couple more trays to get everything nice and straight. But we're pretty much, as long as you're compliant with it, 22 hours a day you're wearing them. But, with metal braces, they're on all the time. So with the luxury of Invisalign, you get to take it out whenever you want. It's pretty much a plastic tray, that plastic mouth guard that goes over the tooth. Every 2 weeks you're changing it, and we're getting some great results. We do a lot of Invisalign, and most of the patients are patients that had braces before that teeth have shifted.
I was going to ask you that question right now. Basically, let's say you had braces before, right?
Yes.
And you didn't wear your retainers, and your teeth are starting to shift, but not as much. Can you come in and get Invisalign?
Yeah, everybody pretty much qualifies for Invisalign, right? Pretty much right off the bat. It just depends on how long it's going to take. So for like the severe cases, Invisalign might not be the key. We've done some severe cases where you had teeth all over the place with Invisalign, and it's worked. It's taken a long time, but it's worked. But your average person coming in with crooked teeth, that's what Invisalign is made for. It's pretty much made for braces for the adult. Especially for like the tough cases to do with them, Invisalign has come a long way. I think Invisalign is over 20 years old. So in the beginning, when it first came out, everybody was saying, no, it's not a great thing. Plastic is not going to move teeth like metal would. But technology goes a long way, and definitely works.
And then does insurance actually cover Invisalign?
Some insurances do. What we tell our patients, if your insurance does cover it, they would pretty much fill out the paperwork for them, and insurance would reimburse partial payment of it. But it's usually one of those things where most of the time it's considered cosmetic. But if insurance does cover it, which is not often, insurance usually will cover a person till about 19 years old. Mm-hmm. Above 19 years old, it's hard to find a plan that actually covers it. But they also cover a small amount of it. So
let's say somebody's insurance doesn't cover Invisalign, right? What is the out-of-pocket cost for this?
Usually it's about $4,500 to $5,500 in our office. The fees include, with a lot of offices, you see, we don't really advertise much, so we don't really get into the whole game of, hey, it's $1,000 or hey, it's $2,000. We give you a flat fee from start to finish, and it's guaranteed results. Where you see a lot of prices with the advertising where it's like $2,000 or $3,000, it's only for the minute cases. So it's like a bait and switch type of thing where you go in and you find out you have to pay $1,000 for the retainer, and you have to pay $1,000 for the refinement, which is why I really always mention that 85% of the time we're going to get it right. 85% of the time, actually, towards the end, we're not fully there. No matter how good we are, no matter how compliant you are, these are plastic trays that are going over the teeth. So we're always off by a little bit towards the end. Well, we like to be honest about that in the beginning because we want your expectations to be what our expectations are. So towards the end, we have something called a refinement. So we take a new set of impressions, send them in, and then get a couple more trays just to get exactly what we want. And that's really where another 1,500 would be in another office, but for us it's all included in the price because we know what we're expecting. We do so much of them.
You guys are basically straight to the point.
Yeah. From the consultation. I mean, we never had to do any advertisements. It was most of our approaches with patients is pretty much honesty from the consultation in the beginning, what you're going to expect, what we're going to expect, what we can do, what we cannot do. And that's where we grew a lot of our business pretty much by word of mouth and what to expect and not to expect, and you get to see the difference.
If you guys are not tuning in, you're tuning to Shakil and Company on American Islamic Radio. We're having a great discussion with a dentist, the man, the myth, the legend, the dentist, Dr. Abdulla Zoobi. I'm going to trademark that for you, by the way.
Yeah, right?
The man, the myth, the legend, Dr. Zoobi. So,
God bless you. Really.
We're talking about kids, adults. Now I want to get to the older generation, right? Yeah. Those who are actually using dental implants.
Yes. So, that's the fun stuff for us. We do a lot of implants. We do a lot of surgeries. We restore a lot of these cases where, a lot of our people from back home, they never really took care of it. If they end up getting a toothache, it's always, when in doubt, take it out. So we get a lot of patients where we're actually placing a lot of implants on, we're restoring their smile. And those are the fun cases to do because we get them from start to finish and actually give them something back to natural teeth, something that looks better than it was before. And we do a lot of our own bone grafts, we do a lot of our own sinus lifts, do a lot of our own implants. They're really fun to do. There's most of our cases that we do are pretty much people with bombed out mouths. They have everything is all over the place, and we get a lot of those. That's our community. It's like this is what we're here for. We would do a lot of our cases are pretty much full extractions the same day. A lot of implants get thrown in the same day, and we make you a nice little temporary. You're walking out the same day with teeth. That is our ultimate goal. If we can get that done, and if everything falls into place where that can be done, that is the best case scenario. You're getting teeth the same day. You're getting about 8 to 10 implants per arch the same day with a full smile.
How painful is that, though?
Believe it or not, it's not, as long as we get teeth in the same day, it's not painful because the temporaries that we make block the surgical site. So you get to go home, get to enjoy a nice meal. You don't feel where the surgical site is. You feel a little bit of soreness for a few days, nothing really major, but not to the point where you would think, like surgery in bone, nerves. There's not that much nerves within the bone, so you're not really feeling the bone. You're really feeling where the tissue is. A little bruising, a little bit of swelling. But a lot of our cases are those, and they're fun cases to do. But going back to the whole advertising thing, people will come in, get a full new smile the same day, go to their friends and look at my smile, and they're having dinner then the same night with their friends. So that's the best advertisement you can get. You're not going to get better than that.
Best word of mouth.
Best is word of mouth, literally.
So, Dr. Zoobi, I have a question for you, right? Implants and dentures.
Dentures are a no-no.
Why?
Well, first and foremost, the guys that used to do the dentures, they're retired. So so definitely back in the day, a lot of dentures used to do, a lot of dentists used to do the dentures within the office itself. That's a dying art. So we rely on a lot of lab technicians to actually do the dentures. So best case scenario, you're getting a denture done by a lab technician. Come in a couple times, get the fittings done. Maybe go visit a facility where they do the denture the same day. Denture, you're planning on that denture sticking onto your gums, chewing with it, and you're chewing on both sides, kind of like a cow. Usually, we normally chew on one side. Your jaw kind of does this while you're chewing. So when you're wearing a denture, you actually have to have food on the right, food on the right, food on the left, and you're chomping. They're not great. They're moving around. They're not fitting right. What we're trained to do as dentists is tell the patient it's all about the patient's attitude. If you accept this and you're okay with this and you're positive wearing this denture, it's going to be great. It's going to fit great, but it's really not. It is true though. A lot of the patients that are okay with the denture will like it. They'll get accustomed to it. But it's pretty much telling a patient, hey, take these plastic chompers and chomp away. And you're really relying on those patients to accept that. And with implants, we don't have to accept that.
So now, who is a candidate for implants?
Pretty much whoever's missing teeth, whoever has bad teeth.
Let's say I have like 2 or 3 teeth
So if you're missing a tooth, you could definitely do an implant on that site. We can pretty much looking at bone levels. We send you our first step when we're treating planning implants is pretty much sending you for a CAT scan. Well, it's not a full CAT scan. It's called a colon scan.
Okay.
It takes about 20 seconds to do. Goes around your face once, kind of like you're taking a regular X-ray in a dental office, and it gives us the exact anatomy of the bone. So we see how long the bone is. We see if there's any nerves, any blood vessels, to see what's going on pretty much within that site. We take a look at that. We take our measurements. That's pretty much like, let's say if we're doing one implant missing a tooth, putting in an implant. It's like a 15-minute surgery. Now we have these surgical guides where a computer actually makes a little stent for us, so we don't even have to open the gums.
Wow.
All we're doing is pretty much drilling a hole in a plastic hole. And it clears the site. It knows exactly where to go from that CAT scan. And we've done a lot of cases where it literally took us 2 minutes to place the implant.
So basically, technology's
there. The technology is amazing. Every day I wake up, there's something new. With these surgical guides, they're amazing. And we do a lot of cases with surgical guides. We just throw it in with the package just make it easier. Easy user creation. A lot of our patients come in there, they're scared. They're just going to see a
That
dentist.
traumatized feeling I was talking about earlier.
Yeah, I mean, if it took a dentist an hour to take out a tooth, then how are you going to restore a tooth? How are you going to put the implant in? The patient's thinking everything under the sun is going to happen, but a lot of the implant surgeries are pretty easy. Some patients come in with hardly any bone. Those are the cases where we actually have to put a little bit of bone in first, give it a couple of months for it to heal. And those cases take a couple of months for it to really come into position. You're not getting a tooth the same day, so it's definitely something it's a process.
This just piqued my interest. How do you add a bone to your teeth?
Oh, it's amazing. The way God created the body is just amazing. Just to see how it works. Alhamdulillah for that. Which reminds me when we're discussing religion with people who just don't believe in religion at all, we say, my always go-to is just look at the way the body works. Just look at the way it functions. If one thing is off, oh my God. So the way the body works in a way is you create a little bit of a space, it fills in with blood. And as long as that space is contained, at the very basic explanation of it, the body itself will go into that little blood clot that you formed over there and actually start making bone. So what we do is we fill in that space with artificial bone. What the body then does over the next probably 3 months to 6 months, depending on the site, starts bridging a whole network of calcium to regrow that bone. So it's amazing. It's amazing. But the problem with a lot of our denture wearers is when you're wearing a denture for a couple of years, that denture is really laying flat on that bone, and it's really wearing away at that bone. So let's say you just got a whole bunch of teeth taken out, and you're wearing a denture. I would take advantage and get the implants done as soon as possible. Because a couple of years of wearing that denture, you're losing more and more bone. It's going to make the whole process a lot harder. It still can be done, but why go for 3 surgeries for bone grafts and then implants and then teeth when you can just have one surgery where you get everything done and it's a lot easier. It's definitely a lot easier.
So Dr. Zoobi, you're a dentist, right? And I've always I want to ask you this, but it's always in my mouth. What joy and satisfaction do you get from being a dentist?
Oh, it's definitely fun. It's definitely, it was one of those things where you're in school and like, what am I going to do? My dad's a retired carpenter, and growing up with him, we were doing a lot of things with our hands, whether it was, my dad thought he knew everything. So we did electrical, we did plumbing, we built houses, we built rooms, we've built windows, we've installed windows, we've done everything. From being a kid, I went into college and dental school with tar on my hands. From reglazing roofs. So we did everything.
He's a man of all trades,
yeah.
Guys, all man of all trades.
So one thing I learned in dental school, it's a lot of carpentry, a lot of handwork. So it's pretty much everything I've grown up doing in the mouth. And it was, for me, that was gold because this is the stuff I enjoyed doing as a kid. So that whole trade, really came through. And definitely was the icing on the cake for the field.
So if you have a viewer who's listening out there to you, right, who's thinking about becoming a dentist, what advice would you give them?
Oh, definitely a great field. Definitely a great field. It's definitely fun. The way medicine is going and the way everything is going these days, you go to a doctor, they're on the computer, they don't even look at you.
Exactly.
They're on the computer typing in. You'll be over there sitting. They'll ask you a bunch of questions, and they're typing out your whole chart on the computer, which is not fun. So with dentistry, it's actually more engaging. You get to meet the patients. You're actually doing physical work on a patient. So that to me is very rewarding. A patient coming in pain, whatever you're doing for them, whether it's a filling, a cleaning, you're actually doing something. You're seeing your work live. So that's very rewarding. Definitely rewarding. It's definitely a great field where you definitely get some sense of accomplishment with the work you're doing. But it's also it's a fun field. It's definitely a great time, especially with technology, the way technology is going. Where you get to do so much. Within a day, we would do Invisalign. We would do a couple of root canals. We would do an implant, and then back to a clinic. So it's definitely your day. There's so much to do within a day.
No wonder I couldn't get you out here for so long.
Yeah, only for you. It took us about an hour and a half to get here. So got the kids here, so they enjoy the trip.
Kids, by the way. So any of your kids want to become dentists?
Oh, I'm hoping for it. We'll see how it goes. I'm definitely planting those seeds in them. So we'll see. Inshallah.
Last question, and it's the question that everybody and their mom wants to know. When a dentist is inside your mouth, right?
Yes.
And you're talking to them.
Yes.
And we're trying to talk back.
I get that all
Do
the
you
time.
understand us?
Oh, yes. We're usually looking for, well, to be honest, when we're asking questions and we're in your mouth, it's kind of like us pulling a answer. It's not going to happen. So it's probably one of those inside jokes. We get real. We get real. But most of the times we're so accustomed to, well, what's going on here? We're not on the computer pulling this. We're actually doing this and asking you the question. Well, we kind of know the answers to most of the questions just by looking at it.
Dr. Zoobi, thank you so much for
please,
coming
God bless
out
you
here.
for having me.
Our viewers, we're going to definitely have him back probably once a month, inshallah.
It'll be fun.
That's the plan.
Yeah.
I want to learn more about what's going on in your teeth to inform our viewers. You guys have been tuned to Shakil and Company on America's Islamic Radio. Again, this interview was sponsored by JG Advisors, Elements Dental, AT&T Storage, The Mugs and Beans, Tech Bite, Gyro Spot, Dreamland Brokerage, and Glide Management. You guys enjoy the rest of your evening. Assalamu alaikum.